Hi there. This is Dr. John Whitcomb talking about the hormonal effects of omega fats. This is actually quite an important issue. In 1950, after World War II, food companies had become very large, feeding the American armed forces, and corporate food production ensued. And every single animal in America that had used to be fed on grass pastures was moved to feedlots. And when they're moved to feedlots, they eat corn and beans instead of grass. Animals that eat grass have 6 to 7% of their fat omega-3 fatty acids. Animals that eat corn and beans get so much fat in them that they become completely full of saturated fat within just a few weeks. So grass-raised animals do you no good if they aren't grass finished. Well, through most of human history, our ratio of omega-3 to omega-6 fatty acids, and 3s are the anti-inflammatory, omega-6s are the precursors to the inflammatory family of messengers, eicosanoids. The ratio used to be 3 to 1, or maybe 1 to 2. 1 to 2, 1 to 3, somewhere in that range. But because we've lost so many omega-3s, probably in the range of 80%, and increased omega-6s because of the dramatic increase in industrial vegetable oil production. So corn, canola, soybean oils all have rich concentrations of omega-6. So our ratio that used to be 1 to 2 is now 1 to 20, 1 to 50, all depending on how much fried food you eat. But omega-6s are everywhere. And that means the meat you eat is filled with those foods. And that means we are getting that when we eat our foods. And saturated fat acts like LPSs, lipopolysaccharides, in our gut and sets off inflammation. Oh dear, that's a problem. Do we have proof of it? Well, precious little, but there's been some studies comparing the diet of Koreans and Japanese and Icelanders and Americans. Okay? Guess who has the most heart disease? Americans, and we eat the least omega-3 fats. And in almost a linear basis, Icelanders who eat a fair amount of ocean-caught haddock, which doesn't have much fat in it, but quite a lot of grass-raised lamb, which does. Koreans and Japanese eat tons of seafood right from the sea, and they've got omega-3 fats in that. And they have commensurate less heart disease, less dementia. Another example is polycystic ovarian syndrome, the bane on them. Like 1 in 6 or 1 in 8 women have it, have trouble getting pregnant, are insulin resistant, get overweight easily. Multiple studies in animals, some in humans, show that when you feed them more omega-3 fats, their polycystic ovarian disease gets better, suggesting, yes, that's the one study we finally shown. We have very little research, but intuitively you have to know that's what's happening. And if our pregnancy and fertility is at risk, if our heart disease is at risk, that suggests there's a lot more wicked things under all these rocks. And the more we turn over, the more we're going to discover. What will work for me? Do your best to eat grass-raised animals only if you're going to eat meat. Consider switching off meat to just being a vegan and getting your omega-3 fats from flaxseed. You get good omega-3 fats from ground flaxseed. But I think we have a problem, and that is this great transition off the farmland, off the grass, onto feedlots, and with omega-6 fats from vegetable oils is not doing us a good service. Certainly cut down on your vegetable oils. If you want a safe oil, eat mono unsaturated like olive oil or avocado oil. This is Dr. John Whitcomb for News and Nutrition.